Sculptra and facelifts. This is something that's really important that I feel really strongly about. There are two sides to this. There is a big group of surgeons that say that if you are interested in having a facelift, you should not be getting Sculptra because what it can do is it can scar the tissues down and make it impossible or really dangerous for you to have a facelift. I completely disagree with that. I also disagree with the other side that are saying that through non-invasive measures, through Sculptra, through radiofrequency, through lots of in-office treatments, you can avoid having a facelift. There are things that you can do in the operating room that you cannot achieve with the device. I think handicapping yourself by removing some of these options, such as Sculptra, is a terrible disservice to do to patients as well. I think Sculptra is a beautiful product. There's really good evidence-based medicine behind its rejuvenation factors. Not only does it produce collagen, it produces elastin, things that are needed to improve your skin quality, your skin texture, and subtle volume. So I think it's a great tool. I use it in young patients. I use it in patients after facelift surgery. I will use it sparingly in patients before facelift surgery, but it's really important that your injector is really comfortable with the planes. When injected appropriately in the subcutaneous plane or supraperiosteal, which is the on-label injection areas, it's not going to affect my deep plane facelift techniques. And so that's something where finding an experienced injector who knows the anatomy is key in this. I also like patients to avoid it a year before surgery. So if you know in the next year, say in the next 2025, 2026, you're planning facelift surgery, that is when I would rein it in on having your injectable procedures, undergo a consultation, discuss with your surgeons the pros and cons of what non-invasive stuff you're doing.